Hi, I'm Dustin. I'm a respiratory therapy coach. And I've heard some patients come to me and they're just struggling to sleep because they have so much back pain, nerve pain. The doctor said they have restless leg syndrome or neuropathy. These all affect your sleep. And I'm going to walk you through it. So main thing it does, it affects your sleep cycle, your circadian rhythm, your nervous system recovery, breathing patterns, and your oxygen stability. In your anatomy, the neuropathy is when nerves are damaged or irritated. So they're sending abnormal signals like burning sensation, tingling, electric shock, or numbness, or temperature will be more sensitive because your nerves are not functioning properly. And then your brain has a lot of trouble calming down. When your nervous system isn't calming down at sleep time, it's very hard to have deep sleep. When your nervous system is activated at nighttime when you sleep, it's called light sleep. We want deep sleep. Got it? We want deep sleep. Then some people might experience restless leg syndrome. So what is that? So you like to dance when you sleep, pretty much. Movement helps decrease the sensation of restless leg syndrome. So you move around, you're constantly moving. It's like a crawling sensation, tingling, pulling feeling, and movement temporarily fixes that. But what's really causing it is the dopamine signaling imbalance, or it could be an iron regulation in your brain that's imbalanced as well. And then your nervous system is overactivated. Symptoms get worse at night because that's when the brain naturally changes dopamine activity right before sleep. Now, let's move on to chronic pain. Pain is something we all deal with. It's part of our life. It's what makes us alive. But sometimes chronic pain can lead to emotional reactions where you feel just overwhelmed and just never can get away from it. That can lead to hormonal type stress. Your hormones can be overactivated and you feel like you just cannot settle down. You're always alert for dangers. That is not a good way to sleep. Our body's meant to repair when we sleep, not protect. So we have to find more than one way to help us get to our body's repair mode before we sleep. Breathing connection is so affected by pain in your nervous system reaction. When we have these type of pains, we tend to breathe shallow, especially when we're in pain. We're not going to breathe deep when we're in pain. We'll have increased anxiety because of this as well. And then over time, chest tightness. So we got to be aware of these things and how they affect our sleep. Because if you're recognizing that you are having difficulty sleeping, you're waking up a lot, your legs are kicking, and you're exhausted, morning headaches, those are no fun. Brain fog, my least favorite. Increased anxiety and you're feeling tired all day, these could be related to pain that's not being properly managed and you're not able to shut down your nervous system. So what can we do? Physicians have recommended magnesium glycinate as a great way to help relax your muscles and help calm your nervous system and maybe improve your sleep. I've used it for myself. It's helped me sleep better. Some people have iron deficiencies. Test your iron deficiency. It's not required for all, but that might be another reason. D3 is very helpful for people to help with chronic pain. It works well with magnesium glycinate, is what's been studied, and can even also help some people with sleep and muscle discomfort. Additionally, you can add B12 complexes. Methylated B complexes are the easiest to absorb. That helps your nerve signals. You can even add omega-3 fatty acids to help as a natural antioxidant and helps your body heal. Potassium and whole foods are good as well. That's where we get those good nerve functioning foods and helps with our muscles. It gives us those vitamins we need, those potassium, the sodium, the magnesium, all those other things we need. Electrolytes will help you as well to help your nerve function. Nutrition you can do whole foods, whole fruits and vegetables, high quality protein, include the skin and the fat. And then also include your healthy fats like avocados, eggs, all that stuff, so what your body needs. Try to cut back on those sugars. If you do any sugars, take the natural sugars from fruits and high fiber. Avoid alcohol We all know about smoking and vaping. Don't do that as well. We're trying to decrease your inflammation in your body, which then will increase your oxidative stress, which then leads to inflammation and then causes nerve misfunctioning and muscle not working properly. Exercise you can do to help your muscles is walking. It's a simple benefit. It helps improve your circulation, reduces nervous system stress, and helps regulate your sleep hormones. Gentle stretching, especially your calves, hamstring, your hip, and low back, before, during, and after you sleep. Nasal breathing exercises, breathing slowly in your nose on the count of 4, and exhale on the count of 6. Do this for about 5 to 10 minutes to help regulate your nervous system. Now, there's a mind-nervous system connection. Chronic pain trains the nervous system to stay alert. Helpful tools are meditation to be aware of your surroundings. First, start with simple this. I'm aware of my breath coming in and out. I follow it. And then choose an object that you're aware in front of you. Recognize its texture, what it sees like, what it feels like. And then recognize a feeling. I feel joy. Where do I feel this joy? I feel it in my skin. Radiates. And then do this throughout the day. Recognize a feeling and separate the feeling from a meaning. Just saying it's a feeling. And say, I feel this. And then we're going to talk about the body. I feel something in my back. I just feel it. Just breathe through it. It allows your body to disconnect from the meaning of it. It's just a thing. The pain in your back, kicking your legs, it's just a thing that's happening. It doesn't mean anything. Now we're going to practice sleep. Here's some good sleep advice I'm going to provide for you. Keep your room cool. Most people tend to sleep better in a cooler temperature. When you sweat, it's hot, you tend to move a lot when you sleep. Your body has trouble settling down. Use consistent sleep schedules. So if you sleep at 9, go to bed at 9. Sleep at 10, go to bed at 10. Then also be aware of your blue lights, your cell phones, your laptops, your TVs. No blue lights 2 hours before bed. Okay? And I would recommend no people talking as well before bed. No caffeine before bed. I recommend caffeine earlier in the day, at least 10 hours before bed. All right? You can have a light meal and make sure you do all your stuff for work that really matters before bed. The goal is to help your body go from protect to healing mode. Protect to healing so you can go to a nice deep sleep. Now also provide a simple pillow position. You can add a pillow for your knees, between your legs, and a light neck support. The neck support I use is basically the size of my fist. You can even do a warm bath or heat before bed. Heat your bed. This allows your muscles to relax, your nervous system to calm down. Avoid heavy meals, like I mentioned, before bed. What this causes specifically can cause inflammation and reflux. It's okay to have a heavy meal in the middle of the day because your body has the opportunity to break it down, metabolize it, and use it. But if you're doing it while sleeping, it tends to cause reflux because of the position of your esophagus. Here are some medications that some people have found helpful with chronic pain and nerve dysfunction. Gabapentin has been known to help with nerve pain for some. Pregabalin or Lyrica has been known to help you with nerve pain. Dopamine agonists, iron replacements, and sleep apnea treatment has helped some people, like a CPAP machine. It's important that some sleep medications worsen breathing disorders, so be aware of that. So if you're taking some high sedatives, opiates, be aware of those, okay? Benadryl, any of these medications that cause increases your drowsiness on a higher dose than normal that are meant for sedation, be aware that it might make your sleeping worse. Many patients with neuropathy, chronic pain, or restless-leg syndrome also have sleep apnea, where your shallow night breathing can lead to oxygen depletion. So you might need a sleep test. And you might need someone like me afterwards to help you set up on a CPAP machine. The truth is your body is not failing you. Your nervous system has stayed active for just too long. The goal isn't perfection. The goal is to have a calm system, improve your circadian rhythm, and restore recovery cycle. The goal in the next 3 months is to improve sleep consistency, reduce nighttime nervousness, nervous system activation, support nerve health, improve breathing quality in and out your nose. These small changes repeated daily can make a massive difference. Because better sleep is not just about sleeping pills. It's about breathing, nervous system balance, inflammation control, movement, recovery. And you're not weak for struggling with sleep while carrying pain. You are real physiologic reasons behind it. And the real tools that can help. It's a privilege to help you find and use these tools and to bring health back into your hands. Thank you, and God bless.